got diagnosed, I used to be very thin talaga. Thin, with regular menstruation, but late 2015, sometime around December or November, I was diagnosed with PCOS. That time, ang PCOS, hindi pa siya basically well-explained. Dito na si PCOS nag-strike sa health ko. Nung nag-start akong mag-breastfeed, tapos in-stop ko na lahat. As in, kasi syempre, when you're breastfeeding, hindi ka pwedeng mag-diet. Kaya din siguro, I started having hypoglyce, especially ng afternoon. Tapos, yung weight ko, as in, ang laki ko, I started gaining weight. Super drastic yung pag-change ng weight ko from size 2 to size 8. As in, ang laki. Tapos, ang baba na ng confidence ko. Sabi na ng mga brother ko, mukha na daw kong aparador, mukha na daw kong gasol. Aside from the hypoglyco, drastic weight gain, meron pa akong migraine, chronic migraine. Mainit, malamig, whenever I'm stressed, ang sakit. So, parang binabasag talaga siya. Nahihilo na ako talaga, nagsushoot up yung blood pressure ko. Kahit walang trigger.
How did you come across Simply Nature PPARs?
Nalaman ko siya through Ma'am Jansen and Mr. Shyan. So, they introduced PPAR to me kasi one time we were having lunch. So, very big yung appetite ko. Akong excuse si Ma'am, always tired meal. Ako, he looks 30s, 20-something, mga ganon. So, sabi ko, gusto ko ako din. Kailangan, paglaki ng anak ko, mukha lang kaming friends. When I started using PPARs, first month pa lang. Actually, first week pa lang, I started texting them na, Sir Shyan, Ma'am Jocelyn, I don't have episodes of migraine at all. Kasi yun talagang kita ko. Kasi everyday, nafe-feel mo eh. Wala, even if it's cold, it's hot. Yes, kasi sabi nila, ang hirap daw, sabi ng doctors, once you got diagnosed with DM2 or diabetes, it's really hard na i-reverse.
Exactly. How did your doctors react?
They were amazed yung OB ko. First time, kasi OB ko na sila before pa eh. So, first time, since 2015, kahit ako, first time naming makakita ng clear, normal.
Guys, just to let you know, as you can see on your screen, the result actually says ovarian is bilateral. So, both sides.
Yes, bilateral. More than 20. Tapos may specific size pa siya. I can share naman yung lab result. Tapos ngayon, left is already clear and normal. Tapos yung right ko, reduced na yung size. So, working on it para ma-clear na siya. So, first of all, I wanna thank Sir Shyan and Ma'am Jocelyn. Really, as in, sobrang thankful ako sa kanila. I thank God for their lives. I have nothing but gratitude for them. Having this product improve my way of life talaga, as in. Tapos more pa para yung ibang friends ko, actually nakikita na rin nila eh. Encourage ko na rin sila, medyo nire-refer ko na rin sila. Tapos kaya mo rin to.
Exactly. And just like how Sir Shyan and Ma'am Jocelyn did it to you, it wouldn't be hard anymore because they see the improvement, they see the result on you as well.
Living witness na sila eh kung ano yung nangyaring changes. Good morning, I am Monique B. Marzad, 31 years old. I'm currently working as a property manager here in BGC. I was diagnosed 2015 with PCOS and I started gaining weight, having high blood sugar and then high cholesterol after I gave birth. And then when I started using PPAR, the migraine episodes, hypogly, and my drastic gaining of weight stopped. As mentioned, I started to lose weight and look more vibrant. So I trust Simply Nature.
Even before pregnancy, I'm already taking PPARs. My husband and I, we were really taking, I think during the time, we've been taking it consistently for 5 to 6 months already, PPARs tablets. So, I even think that helped us during the this pregnancy because based on our experience, we had 2 miscarriages before my 3rd pregnancy and my successful pregnancy. And that time, we've been told that, oh, it's not healthy, that's why you're losing the baby. And then we're just, waiting on the Lord and praying for His timing. And during the time when I got pregnant, I also realized that, oh, actually we've been taking PPARs. So, because I've read and heard that PPARs helps with cell repairs, it strengthens your body, it's high in antioxidants and all that. You know, I really think that that contributed for us to have a healthy pregnancy. And yeah, that's what I also took during that time. After I have given birth, I really had difficulty because I had emergency CS. So, but after, on the third day onwards, I was actually feeling better. After giving birth, we're gifted with PPAR, so praise God, and that has helped me a lot because they said that the hormonal changes do not just happen during pregnancy and even after pregnancy. So, we started taking PPARs also. And I know mommies who have given birth, I know you can relate to this. If you have experienced constipation before birth, when you have given birth, it becomes like more. It gets to the next level of constipation. So I'm glad I was able to take, and I was introduced to Cleansing Plus of Simply Nature even before pregnancy. So when I experienced all this constipation, when I took Cleansing Plus, it has helped me with my regular bowel movements and to be able to release easier and faster. When I felt constipated, because it's true, even after you have given birth, if you're already constipated, it's like it's gonna go to the next level of constipation. I don't know how it happened, but when I read about it, it's all because of the hormonal changes that happens in our body and our body adjusting and healing. So it's going through a lot. It has helped me because especially if you have given birth, whether that's normal delivery or you had cesarean, you're not really allowed to put pressure when you're about to go. So you're not allowed to push. So the Cleansing Plus really helps, no, for you to be able to release, better and easier. What has helped me in this pregnancy journey and even before that and even after is that I was taking PPARs. My husband and I were taking PPARs tablets. So that has helped me with, of course, the hormonal imbalances. It has helped us to regulate, and it has given us more energy and have healthier bodies. So it has no contraindication, so that would also help you. So you may try on your own and test it for yourself. Hi, I'm Nesta Vicencio, and here's my son, Ethan Kairos. So I had an amazing pregnancy journey and recovery with the help of Simply Nature PPARs. Thank you, Simply Nature. We love you.
Good morning, I'm Mrs. Melinda C. Hispano. Ako po ay na-diagnose ng stage 2B breast cancer and I'm from Muntinlupa City. I'm a public school teacher. Nung nalaman ko po na na-diagnose ako ng breast cancer, syempre may devastated po. And of course, the whole family, parang our world, no, falls apart, no? Sobrang down. There is no symptoms eh. I just felt the lump. Dalawang lump siya sa right breast. And I was not really going for a check-up sa lumps. I was, magpapa-check up ako sa OB-GYN ko. And I was advised to go to the surgeon kaagad. So, after po ng operation, I was asked to go to oncologist. The protocol is to have 8 cycles of chemo and 33 radiation. When I was in the hospital, sa aking bed, browsing through the Facebook, I saw the face of Dr. Jansen. Sabi niya, makakatulong po sa mga chemo patient, yung Simply Nature PPARs. So if you will just try, malaking benefit po sa katulad naming mga cancer patient. I was advised to supplement chemo with PPAR powder saka tablet. So at first I was hesitant kasi very mahal po siya. Pero first chemo ko, taking PPARs, hindi po ako nahirapan. So I was expecting na yung mga nababasa ko, napapanood ko ng mga side effect of chemo. Hindi ko po siya naramdaman. So I was telling my family na parang maganda po yung PPAR sa akin. I finished the whole 8 cycles without any problem. Thanks to my doctor and the Simply PPAR. Kasi po, even my co-teachers, even my family, sabi po sa akin, hindi ka mukhang may sakit. So that must be a blessing from up high there, no? That I was able to meet Dr. Jansen and I was able to take Simply Nature PPAR. Latest result of my laboratory, all are normal. Yes, thank you, Lord. Continuous pa rin po yung tablet. So I just ordered 6 ngayong May. So that would last for ilang months. My latest ultrasound, fixed pa din po siya. No calcification or anything. So I thank God for that. Mapapayo ko po sa mga pasyente po na katulad ko, go to the right doctor, no? You pray for the right doctor. Kasi ako pinray ko lang para bigyan kayo ng the right supplements. And para yung journey nyo, yung cancer journey nyo, will be very successful. Kaya nga sabi ko, during my PPAR journey, sabi ko sa sarili ko na I will be the most successful chemo patient in the whole wide world. Thanks, PPAR. I will highly recommend po Simply Nature PPAR kasi based on my own experience, it helps me a lot talaga. And it's a blessing to me na take ko yung PPARs. Kaya nga ang sabi ko, I will be the most successful chemo patient kasi may supplement ako galing sa Simply Nature, which is PPAR powder and PPAR tablet. So, blend together, it helps me a lot. And I'd like to thank my daughter, si Cadiz, and also my husband for taking care of me. Hindi siya nagsisisi on that part. Thankful po siya. Kaya nga, nung sabi ko, a-attend kami, and he was very supportive, binatid niya ako dito. I am Melinda C. Spano. I'm a public school teacher. I was diagnosed with stage 2B breast cancer. Upon knowing my situation, it was really a very devastating event. I was advised to do 8 cycles of chemotherapy and natatakot ako dun sa chemotherapy. But with the help of Simply Nature, na-surpass ko, nakatulong po sa akin. It's a big help. Lahat po ng side effects ng chemo, hindi ko po naramdaman. So, I'm very, very thankful to Simply Nature because it really helps me a lot. And ang feeling ko, I'm a very successful chemo patient because of Simply Nature. I trust Simply Nature.
And we are live! Healthy day, everyone! My name is Jenny Macanjola, a licensed pharmacist and one of your trusted health advisors here in Simply Nature. Okay, wait, pause. Back. Last week, we talked about the estrogen equation, strategies to reduce recurrence and strengthen cellular integrity. But moving on tonight, we'll explore the hormone reset, dissolving the root causes of myomas and PCOS naturally. Okay, I want to start with a question that many of you might be asking yourselves silently. Why does it feel like my own body is working against me? So if you are dealing with myomas or PCOS, you know it's not just about the physical symptoms, the heavy cycles, the fatigue, or the unpredictable weight changes. It's the feeling of being out of sync. For years, the standard approach has been managed to symptoms or opt for surgery, but today we're shifting the conversation. We aren't just looking at the what, we are looking at the how and why. We're talking about the hormone reset and how to dissolve these issues by addressing their root causes naturally. Yes. Okay. So addressing the root of myomas and PCOS aren't just bad luck, guys. Often they are manifestations of metabolic dysfunction and chronic inflammation. Our hormones are like a delicate orchestra. If the conductor, our cellular metabolism, is, say, tired, the music falls apart, of course. So to fix this, we have to talk about cellular activation. This is where many natural protocols fall short. They provide the nutrients, but the cells aren't open to receiving them. Here's the edge of Simply Nature PPARs. This is why I want to highlight a specific breakthrough in nutritional science. So, for a fact, PPARs stands for, I know you know this, guys. You can comment in the section. For our clients, peroxisome proliferator activated receptors are initially the master switches of your cells. Simply Nature PPARs are unique because they contain a high concentration of agonists that directly activate these receptors. When these switches are turned on, they help regulate the very inflammatory pathways that feed myomas and the insulin resistance that drives PCOS. By introducing Simply Nature PPARs into a reset protocol, we aren't just adding a supplement. We are providing a molecular key that tells your body to start preparing itself from the DNA level up. It's about giving your cells the command to burn fat, lower inflammation, and balance estrogen naturally. For the wrap-up, the journey to dissolving myomas and PCOS naturally isn't an overnight fix, but it is a permanent one. When you align your lifestyle with the way your cells are designed to function, your body responds. You don't have to be a passenger in your own health journey anymore. You can be the driver. We've covered the why and a bit of the how today, but I know that your situation is unique. Your body has its own story, and you likely have a specific hurdles you're wondering how to clear. So I want to make sure we address the parts of this journey that matter most to you, whether it's about the science of PPARs, specific dietary shifts, or how to track your progress. Nothing is off the table. I'm sure you have lots of questions, and to guide us through this discussion, we are honored to be joined by leading experts who combine science, experience, and compassion in patient care. First, we have a seasoned international speaker on a wide range of topics from personal success to healthcare, who is also the founding director of Simply Nature International, our PPARS expert from Singapore. You all know him, it's Mr. Shyan Lim. And joining him is Dr. Jansen Kalalan, a graduate of St. Luke's College of Medicine, a diplomate of the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions, including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. Good evening, gentlemen.
Good evening, Jen. Good evening, Doc.
Hello, good evening, good evening. Hello.
Nice new haircut, Doc.
Yeah.
Yes. I feel lighter
No.
by a few grams.
Okay. Well, let's start with the first question coming from privately. Good day. Please tell me much more about your products and how much. I have a cervix mass extending to the uterus 5.42 centimeter, malignant, but I refused biopsy. I want to heal naturally. How did you know it's malignant if she refused biopsy?
Also my question.
So
Yeah.
Jen is doctor standard now. Hallelujah. Well trained. So
Yeah.
probably Probably it's so obvious to her doctor that it's malignant. Doc, what would your advice be for a patient, not this specific patient, but a patient who has similar symptoms?
Okay. I have encountered similar patients actually, no. So, for this kind of case, no, when you see a mass that with that size and well, the doctor might have done a physical exam, and on physical exam you can deduce, no, or let me rephrase, you can make an educated assessment that mass points leads towards a malignant diagnosis with just physical exam alone. Now, in med school, we were trained that history and physical exam alone would already suffice, no? It's enough for us to lead to a diagnosis 80 to 90% of the time. Okay? The 10 to 20% would just be diagnostics for us to confirm our assessment or our diagnosis. So, yeah, with this kind of mass, and if it's the cervix, then, and if your doctor told you that, hey, it is malignant or cancer, then it must be malignant. Okay. So now, if you don't want to undergo biopsy, what are your options? Okay. Now, this is where we divert away from the guidelines. Okay, because the guideline says when you have that kind of mass, when you're suspecting cancer, when you are thinking of treatment, you need to do a tissue biopsy. Okay? Without the tissue biopsy, the doctors would not give you any kind of treatment. They would not know what to give. Okay? Because the treatment is dependent on the diagnosis. Now, that is for the conventional oncology side. Now, for my side, for my part, I use mainly repurposed meds, natural extracts. Okay. So, do I need a specific diagnosis for me to treat cancer? The answer is yes. I still do need a diagnosis for me to expect what will happen next, the consequences, the natural evolution of the disease, or what to expect next. No, I still need the diagnosis. But if the patient refuses, then I would have to require the patient to undergo a liquid biopsy. So a liquid biopsy is a biopsy wherein we get your blood. So now it would be easier now because I only need your blood to get the circulating tumor cells or the cancer cells that's swimming in your blood. Okay? So from the circulating tumor cells that we get, what information do we get from that? We can know what medications and natural extracts that will kill the cancer cells. So it's basically a list. So this is like a cheat sheet that will tell you, okay, these substances will kill the cancer. These substances will not kill the cancer. And how effective will they be? Okay. So with this information, then I would now have a basis to create my protocols from. So it's easier for me. And we are now assured that whatever that we're giving you, it will kill the cancer cells, the circulating tumor cells. Okay? But it's more nuanced than that. It's not as simple as that as well, because I have to take a look at the gene expression, which will also get from that liquid biopsy, analyze the gene expression, and correlate the natural extracts and the medications, which among them should come first, should come next in your journey. Okay? So that's that's what we can do. Okay, now you might be thinking, okay, this test, it sounds expensive. What if I don't have money? Okay, what do I do next? Okay, so this second part, then we have to treat you shotgun approach. We don't have a choice. We don't have a choice. Okay, because in other words, we're going to treat blindly. So it's like hitting a dartboard with your eyes closed. You only have a general direction on where the dartboard is. but you don't know if you're hitting it or not. But anyway, let's throw the dart. We might hit the dartboard. Okay? Something is better than nothing at this point. Okay? So from there, then we will devise. I have another approach for that. It's a long story and we have a lot of questions, but we have that. I can do that as well for patients, especially for if the patient really doesn't have, it's really financially challenged or they're not amenable to do the liquid biopsy. Yeah.
Well, Doc, thank you, Doc, for your answer. I think this is the first time I hear Doc talk so comprehensively because about throwing a dart in a, so number one, I would want to comment that, I can see the progression of Doc even in his practice, right? Starting last year, I remember Doc Jansen was speaking in our program about patient agency, and I can see he's really behaving, adjusting to be able to facilitate patient agency. So when a patient really chooses to eliminate certain treatments, Dr. Jansen doesn't say, I can't treat you, but instead, okay, he's going for the approach where I acknowledge what you don't want to do. I'm letting you know that if you choose this way, you are limiting yourself, but there are still things we can do. So for this particular patient, I really advise you to consult Dr. Jansen, right? And to answer the first part of your question, which is what is our product? Our product is actually PCOS. It can help. It is a gene activator for a cancer patient like yourself. What it will do is it will definitely activate the genes. I'm again using very simple terms. We can go in depth. Just ask a follow-up questions if you want. But it activates your genes so that it will manage your inflammation, which is very important for fighting cancer. It will trigger your immune response. It will activate your dendritic cells. These are basically specific parts and functions of your immune system, because there are many supplements out there that says improve immune system. What does that mean? The immune system is more complicated than just that two words, right? So for our product, it actually stimulates the dendritic cells. This helps to identify the cancer cell in your body. Next, it will actually promote the development of your NK cells. So these are the attacking cells that is part of your immune system. So this will help your body in its fight against cancer. Okay. Next, it will improve your metabolic functions as well. This is again very important. Cancer is also known as a disease of starvation. So all these are important aspects to fighting cancer. Now, if you're going for a totally natural approach, I would say that the Simply Nature liquid extract is going to be your best first foundation. That means that will be the first thing that you take, and then on top of that, right, you combine it with other aspects that Dr. Jansen will then share with you. I do know with many integrative doctors, I think vitamin C is another very key treatment common across many different types of cancer. And it works very well together, our product together with vitamin C. And again, this vitamin C is not your vitamin C Borok or whatever, Boroka that you buy from Mercury drugstore, okay? It's a lot stronger than that. So this, for supplements like that, please go to a qualified integrative doctor or a qualified naturopath. Personally, I would encourage for late-stage cancer patients to go to an integrative doctor. And I do know some naturopathic doctors who are actually very qualified as well. That means they really studied medicine also. It's just that they may not have gone to the full extent as a medical doctor. So find someone qualified to give you good advice, all right? Please don't just go to a network marketing company alone. There are good ones, but the probability that you end up in a wrong one is very high. Okay, I'm not saying that all network marketing companies are not good. I'm just saying that there are many bad ones, so you don't know which one you end up with, okay? So, but when you go to a qualified doctor, it's always someone that's qualified. So please. So if you don't know, then there is the most wonderful doctor in front of you, Dr. Jansen Kalalan. Okay, and make an appointment with him. Jen?
Yes. So for those of you who wish to have a consult with Doc Jansen Kalalan or any of our many PPR partner doctors, you can schedule an appointment using the link in the description box and comment section below. Our caring healthcare specialist, Miss Beth and Miss Irish, will reach out to you shortly. For the next questions coming from YouTube, Miss Vivian, I was already operated 4 times for breast mass. The last operation was January 2025, but last week I have my annual mammogram and they found out there's another solid mass again. I don't want to undergo another operation anymore.
This type of doc, for a patient like this, they will be asking, right? How come you all keep asking me to operate and then it keeps coming back? That it's very natural that they feel tired and like I don't want to listen anymore. If I operate again, it will come back again next year. Is it? I mean, what advice can you give this particular patient?
Okay, you have to undergo the surgery again. But this time, I think there is something missing in the treatment. So, have you asked your doctor if you need radiation therapy? Because for patients who develop breast cancer, especially early stages, who undergo surgery but no radiation therapy, the recurrence risk is substantial. The recurrence risk is substantial. So,
Oh,
usually for early stage breast cancer, especially if we don't, especially for cases wherein we don't see any lymphatic spread yet or lymphatic invasion yet, we usually advise surgery then radiation therapy. So the radiation therapy there is to sterilize the surgical field so that all cancer cells that might have seeded from the procedure, from the surgery, are eradicated. So this is to prevent recurrence. So my question to you is, have you asked your doctor if you need radiation therapy at all? Because if the doctor have advised and yet you did not underwent the radiation therapy, then I'm not surprised why you keep on getting recurrences. Okay? So another thing, no? Now, my suggestion is go for the surgery because the cancer is there. Just cut it out. But after cutting it out, we have to do more now. So what is that more? So that would be one, the radiation therapy. Number two, we might need a liquid biopsy, no, to determine if there are circulating tumor cells already in your body, so we can get you on a recurrence prevention protocol. Yon. So the recurrence prevention protocol, again, I will derive that from the liquid biopsy result. Okay? But without the liquid biopsy result, then it's going to be very difficult. Again, it's going to be very difficult. But aside from that liquid biopsy report, I can look at your metabolic profile, your other health profiles that elevates your risk of recurrence. So some health profiles, no, that examples of health profiles that I look into. One would be insulin resistance. If you have this, or if you are diabetic, then recurrence risk will be high. Number two, if you're on insulin, especially if you're injecting insulin as well. So this is under one. Number two, if you're obese, then yeah, that will also lead to an elevated recurrence risk. Okay. Another one is if you are exposed to plenty of environmental toxins. So these environmental toxins will include your plastics, cosmetics, your personal care products that have fragrances, parabens, these things, no? So we have to look into those things to lessen the risk, to improve preventing for the cancer from coming back. But these are not the priority. The priority would be the radiation therapy, and the other treatments that you might need. Yeah.
I think it's really wonderful, this particular question, because many times for cancer patients, they get so tired and they don't want to go through another procedure again. They feel like, in a way, they've been lied to, or they have been given false hopes, because they went for the procedure, and then the same thing keep coming back, keep coming back. So I think Dr. Jansen did highlight a few things. Many times when your doctors tell you, let's do this procedure, they will also include other procedures, and then you may have opted out from the others. Like, for example, you went for the surgery, but you didn't follow through with the radiation therapy. If that's the case, then that might be one of the reasons why the thing keeps coming back, right? Sometimes it's also for financial reasons. You want to save money lang. So you say, let's do the major procedure, and then we save money on the smaller one. I think not necessary lah, This could be a very simple way of thinking about it, but it will cost you more money in the long run because of the cleanup that you didn't do, and then the tumor comes back. So again, if you're not sure if what you've gone through is complete and that you're missing any protocols, you're missing any steps, then please, I encourage you to have a consult with Dr. Jansen, where he will look through your case file and he will be able to advise you what else can you do to make sure that this time around, when you go, it will be successful. Okay, you will take a look at what. A lot of times also, I think not every doctor is easy to talk to. So it is also true that there must be some rapport between the patient and the doctor. You must be able to freely speak and the doctor understand your concerns as well. So sometimes it's just also about that correct match of a doctor and patient. All right. Thanks.
She has a follow-up information. For that, another solid mass found. They did mammogram and then it recommended for biopsy. The result is, for the breast ultrasound, is BIRADS 4A, low suspicious malignancy. So how PPARs will help me?
Yeah, basically to detox, number one, to detox. Number two, check if you have any metabolic issues to correct that. PPAR agonists also can help slow the spread of cancer. Okay. Yeah, at this point, those are the ones that would be beneficial for you at this point. But again, BIRADS 4A will still require biopsy because BIRADS 4 is still suspicious for malignancy, although it's lower, but still it's BIRADS 4. Okay.
So I will answer the one on the PPARs. The PPARs will actually, like again, I mentioned before, for some patients who choose, which many times is because of age or other factors, when they want to go treat cancer naturally, then Simply Nature PPAR liquid extracts and powder extracts are one of the first foundational supplements that they'll take. What it will do for your cancer, again, I mentioned earlier already, it will strengthen your immune system. So just to be clear, PPARs does not fight cancer directly. Okay, actually, the truth is very few supplements. I can't think of any supplements that actually attacks cancer directly, right? So if there's anyone that tells you that there is, I am doubtful. Okay, one that I can think of is like vitamin C at pro-oxidant level. That means is when your vitamin C becomes toxic, then it's like putting acid, and the acid is killing the tumor. That's the only supplement that I can think of that actually directly acts on the cancer. Most other supplements strengthen your body's systems to be able to deal with the cancer. That's why it's called fighting cancer naturally, right? Your body doing the fighting. So PPARs actually activates all your systems that are directed towards managing cancer, from inflammation to the actual immune system to your metabolic pathways, so that your body will have the sufficient fuel and energy to fight cancer. Okay, so you can start there, take a look at the results, and then adjust your protocol accordingly. Again, since it's a discussion, we can't really give you an actual consult. I would definitely advise you to have a consult with Dr. Jansen.
Thank you.
But I hope that we've given you a direction and given you hope, right? Okay.
Yes, this one from Facebook is kind of general. From Miss Salve Gestosani. How much po and how to use it?
Okay, how much you call our healthcare specialist or CSO, they will tell you. How to use it is very simple. All our products are oral. That means you eat it. Okay. Now, for what dosaging, which product, simply give us a call. Someone will reach out to you. They will specifically ask you a few things. What is the disease that you are trying to fight? Okay, if it's something that our team feels you need a consultation, they will direct you to Dr. Jansen. All right, so this is the way we do things, right? We are responsible. So if there's something that our client service officers cannot answer, and that and they know that a doctor is required, they will send you for a consult with Dr. Jansen. For your information, Jen and Daisy are actually licensed pharmacists. Okay, so they do have sufficient basic knowledge in this area, healthcare knowledge, to be able to help you. And Sheila herself, our head of customer service, her son actually recovered from pediatric cancer. So she's actually a mom of a cancer survivor. She took care of her son throughout the entire process: chemotherapy, radiation therapy, and then supplementation, everything. So she's very experienced going through the thing. So our team will be able to help you. So just drop in your more information. They will reach out to you. All right, Self?
Amazing. Okay, speaking of a more specific advice, next question is from Miss Minerva. I have thyroid nodule on the right side, but it's already calcified. So they went through the left for the fine needle aspiration biopsy. Okay, and the result is suspicious for papillary thyroid carcinoma or Bethesda category 5. What can you advise?
Doc.
Did the report tell did the report tell you to undergo further immunohistochemical staining? Because if it is so, then they're still not convinced with the diagnosis yet. Now you have a suspicious papillary thyroid carcinoma, so they're not 100% yet. I would suggest having the slide, the tissue biopsy. I would suggest have it reread again to get a more definitive diagnosis, to get more confidence. Okay.
What do you call that?
So that's what I would do.
Kind of biopsy,
Yeah.
Doc?
I don't think you have to repeat the biopsy. Just have because there was a sample that was taken. You just have the sample reread again. Reanalyze the sample. Have the pathologist read it again. Because the word suspicious is a very it leads to a vague diagnosis. In other words, they're not 100% confident that it's papillary thyroid carcinoma.
So
Yeah.
basically,
So now,
you will
this
request a second opinion, is it?
biopsy. Yeah. Second opinion, yes. Second opinion. Yeah. And
Okay, that means
now, do we really need the second opinion? I have to take a look at the other data, the other information, the other tests that you have done. Yeah, because the other tests will give me more confidence in saying whether this should be reread or reanalyzed again, or the diagnosis is really papillary thyroid carcinoma. So but at this point, just answering the question, I would suggest to have it read again, the biopsy.
all right. That means you don't have to do a new biopsy. You take your old biopsy results, but get the person to re-examine it. So, you could get a second opinion. That means get another pathologist to look at it, right? So that two different set of eyes will maybe can see something which the other person did not, right? Anyway, there's already suspicions about it. So that's it. If not, have a consult with Dr. Jansen.
Okay, another question from YouTube from Credo. Hi, good evening. What is recommended PPARs for 2 years dialysis patient?
Oh, okay. 2 years dialysis patient. I would just recommend you honestly, soft gel capsules. All right. The reason is this. Start with the soft gel capsules as see how it improves your quality of life. Okay, how it improves your quality of life, and you can later move down to Simply Nature PPAR tablets. Again, I do not know the details of the seriousness of your dialysis, the frequency and everything. So let me share with you why we will recommend that. So soft gel capsule is to assist, right, with the proper function of your body's metabolic pathways, right? So this will definitely help to lessen the load, increase your quality of life. So the best case patient that we know of, right, is someone who is on dialysis for more than 30 years. That's a long time, okay? So this person is already senior citizen. He started dialysis in his late 30s. He's already senior citizen. And he's only been taking the tablets, all right? Then why didn't I recommend the tablets? Because I would say 30 years ago when he started taking the tablets were the only products that we had developed. Right now, the soft gel capsule is actually superior, right? More of the extract, less of the nutrients that your body has to process. Okay, but you can, once your condition stabilize, you can go down to the tablets. But why not try? I would recommend try the soft gel first so that you can see if the PPAR protocol is for you, right? That it will do you good. So the soft gel is stronger than the tablets. So if you take the soft gel, which is a stronger one, you will know whether for your dialysis of 2 years, does it help you with your energy level? Does it even possibly reduce your frequency or need for dialysis? You won't go off dialysis, right? You will have to continue dialysis for the rest of your life. But then we could improve the quality of life, might even affect the frequency of the need for dialysis. So there you go. Right, so I recommend the soft gel, and after that, if you want to downgrade to the tablets, go ahead. And then you will see the difference, right? Then you choose the one that will be better for you. And again, try the soft gel first because it's a stronger one. If it gives you a sense of improvement, then you have found a product to supplement you to improve your quality of life for your entire dialysis process and to hopefully make sure that your body's condition don't worsen. Right. So the good news, our best case patient over 30 years of dialysis, still alive, still eating normally. From what I hear about this patient, his diet is quite normal. All right, not crazy way, but not super regimented. It's quite normal, and he's been enjoying he's been having a good life the last 30 years, even though he's been on dialysis.
That sounds very hopeful. More questions about PPARs. Can a pregnant take it?
Yes, honestly, yes, but there is a caveat. All right, this is personal. Okay, this is my view. Okay, because me and my wife also wanted to have kids. So many people my age going through my things, we had difficulty conceiving. So one of the most common problems for couples who are not able to conceive today is the woman having a hostile womb. All right. So that's one of the common reasons why couples have difficulty. The other one, of course, is the sperm quality of the male, right? So now I'm talking about a pregnancy. So the most sensitive part of pregnancy is the first trimester, right? So from our experience, when the doctor explained to me and my wife, is because your body still can possibly recognize the fertilized egg as an external organism, and that's why it's a hostile womb. The body's immune system actually attacks the baby as it's being developed in the first trimester. So once you reach the second trimester, your fetus is fully attached. It's now part of the mom's body. Then all the wonderful things about PPARs will benefit the development of the child. Right, will actually benefit the development of the child. So the first trimester for many people today is a very sensitive thing. So since I'm only advising you, we're only talking about it over a Zoom. I have no idea what's the state of your health. So I think most doctors today during the first trimester will just do very little. Okay, we'll just do very little. Take the safest things like folic acid. Yeah, because again, the complication nowadays is the immune response of the woman, and I don't have any answer to that. And I know for every baby is very, very precious. Every country has very low birth rate now. So without enough information, I would just advise take it second trimester onwards, and it's really good, right? We have had moms. Okay, so here's because I don't want to sound so conservative, let me also give you cases where my personal friends. So I have a friend who could not get pregnant after being married for 10 years, okay, but they married early. The reason was the wife only has menses twice a year. So there was something irregular about her menses. After taking Simply Nature Pipa powder extract, her menses actually normalized. Now they have 3 kids. Okay, so this, and of course, during the entire pregnancy, she's actually on Pipa extract powder the whole way through. And her kids come out, they are very strong and very good. I know a lot of Pipa babies. So these Pipa babies are actually the parents eat the Pipa tablets, okay, during the entire pregnancy. The mom recovers very quickly. The ones that I know very personally were just sharing with me after she gave birth, 1 hour later, she was walking around the hospital pulling her IV drip along with her. Okay, so she's just so strong. So that's an example of when you take care of yourself during your pregnancy and you have a natural childbirth, how quickly you recover. On the other side, I have friends who doctor make them do 1 month bed rest because the fetus development is sensitive, so on and so forth. All right. So worst comes to worst, last trimester, that's the time you take to strengthen yourself and your baby, get ready for the birth. All right. So that's how I would advise for pregnant ladies. I will be, because of today's issues with infertility and the causes, first trimester is a very sensitive thing for people, possibly for some couples. So in a program like this, I don't know who I'm talking to. This is where I would recommend. Second trimester onwards, you're good to go. If you're really very sensitive and you have had difficulty, past miscarriages, then wait until the last trimester where the baby is normal, everything's good to go. What you're doing is just nourishing yourself and your baby so that the birth will be good.
Dr. Jansen, would you like to add anything?
Yeah, nothing.
Okay, this next question is coming from Shopee. Okay, is PPARs also safe for dogs? One of my dog has a 25-centimeter tumor.
Okay, quickly give your dog Pipa extract powder. All right, it's really good for dogs. I want to share something with you. You know that in Simply Nature, we actually have published medical journals, right? That show the mechanism of action, how Pipa works for how it helps your body fight cancer, activates dendritic cells, You realize something, right, everyone? Before you can do any testing, you test on animals. Okay, that is why whenever we can say for sure, evidence-based, this helps you fight cancer, we tested it on animals first before we can say it because we can put it to human extrapolation and use, right? So yes, it's really, really good. It's so good that my sister is actually in Singapore, is actually in the process of starting up a new company. The brand is actually called Pet Nature, and they're actually launching products for cancer for dogs, all right? And it's basically our Pipa liquid extracts and powder extracts, okay? So yes, it's very, very good for your dog. You will notice your dog will feel more energetic and so on and so forth, all right? So yes, Pipa extract powder. Now, how much? I don't know how big is your dog, and actually it doesn't really matter because I rather give more. I just mentioned just now that me and my wife, we don't have kids, so our dogs are very precious to us. They are like kids. Dog Jansen, he probably doesn't know I gave my geriatric dog Pipa liquid extract. Okay, that's how expensive the products my dogs use. Okay, so yeah, please, it has saved I've had friends who had dogs who had cancer, and they opted because when a dog has cancer, sometimes they're so weak they're not even moving. But the only treatment the oncologist can give a dog is guess what? Chemotherapy. It's actually chemotherapy drugs developed for humans, right? But of course, before they develop it for humans, they tested it on animals. So there's an extrapolation algorithm where they change the dosage for different types of animals. Okay, so the vet said very clearly, because her dog was so weak, that if they go for chemotherapy, it's a good chance the chemotherapy will actually also kill the dog, because the dog might not be able to go through the side effects. So this friend of mine, he recommended pipa powder to the dog owner, which is his business partner. Okay, and guess what? The dog recovered. Totally. And in 2 weeks, the dog was actually walking around. Before that, the dog was like bedridden, not moving at all. So what happened after that is that every month he actually managed to sell like 10 to 15 jars of our pipa extract, all to different dog owners. So he happened to belong to a business group, and everybody there, their children all grow up already. The most precious person in their house now is their dogs. So they all bought pipa powder for their geriatric dogs, who very commonly, when a dog gets old, cancer is another very common thing that happens to dogs, all right? Tumor growth. So the answer is yes and yes and yes.
In your case, sir, did you happen to know if they experience healing crisis also?
Oh, that's the best thing about dogs, right? If you give to a human, they will complain about the taste, complain about yeah, I feel a bit uncomfortable after I eat it. Dogs cannot talk, so whether they have healing crisis or not, most of the owners can't tell. What they can tell is after taking 1 week of the product, the dog is walking around. So that don't need to worry about healing crisis for dogs lah.
All right, we're almost at the end of tonight's session. This will be our last 3 questions for the evening. Okay. Hold on. Okay, let me pull up real quick. Okay, this is coming from Miss Charlene. I would like to ask for PPARs, is it effective for pseudomyxoma peritoneae?
Wow, what's that?
Myxoma peritoneae. It's basically a, how do I simplify this? So this is a mass in your abdomen. Is this cancer? Yes, it is.
Wow.
But it is rare.
Oh, wow.
Okay? Pseudomyxoma peritoneae originates from the appendix. Yeah. It originated from the appendix, but it's slow growing. Now, whether or not we can use PPARs for this, ultimately, we have to do a liquid biopsy and actually test it. Okay? This is very rare, so the data on this is quite limited. So, that is how we know whether PPARs will work for this or not. Number one. Number two, are there any other factors in your health, no, that we can use PPARs for? No, same thing applies. Insulin resistance, obesity, these will worsen this condition. Okay, so those are the things that we can address, though, using PPARs. Yeah, so we address directly the issue or the tumor itself, or we address the risk factors that makes the cancer worse. Okay, so that's how we can apply PPARs for this. Yeah, so but basically the things that we can use PPARs for would be metabolic, immune, and cytotoxic, or controlling the spread of the cancer or controlling the growth of the cancer. Okay, so those are the applications that we can use this for.
Dr. Jansen has said it already. So straight away, you are definitely going to benefit from the PPARs, either by managing the cofactors that helps you fight cancer and makes it difficult for the cancer to develop, to increase and to grow. Now, whether it will be super effective or targetedly effective for your particular type of cancer, to know that we will have to do additional tests, right? But you can start with that and then go for your test. Or for example, you start with the product, you notice you have some good progress, then that means the product is doing something, either it's really changing the environment, helping your body resist and fight the cancer, or it's actually also, in addition to that, really working well on the cancer. And you could do further investigation to see how you can get even better results, right? Yeah. At the worst case scenario, even in the worst case scenario, it's going to help to your body's metabolic syndromes and all that to normalize, reduce inflammation, and that's just going to help you fight cancer. Okay.
Okay, our second to the last question. Can I still get pregnant even if I have PCOS?
Yep.
Yep.
You can.
No, isn't it a common thing that for PCOS, or is it myoma, that they actually wait for after the pregnancy and clear everything at the same time? Is that myoma?
Not really. Not really. Myoma can disappear after menopause.
Oh, okay. All
Yeah,
right.
but if you have myoma, it can also make pregnancy a little bit more difficult depending on where the myoma is. Yeah.
Okay.
It can also
All right.
increase the risk of miscarriage.
Okay, as a side topic, one of the more senior endocrinologists in Philippines, Dr. Lizo, during a actual convention, it's actually called Prima. It's called Prima. There was a doctor that asked, because I was a guest speaker speaking on PCOS, asked me this question: Can people help with PCOS? Before I gave an answer, Dr. Lizo actually raised his hands and took the mic and said, "Yes, I have treated many PCOS patients with soft gel capsule." So since you want to know about pregnancy, here's the good news. Or why don't you also right now start to do something about your PCOS? All right. So if you're trying to get pregnant, let me share with you. Just now I answered a question: should pregnant women take PCOS? Right? I said, because of the difficulty and complications about infertility issues nowadays, we generally are very careful with anything to do in the first trimester. Okay. Now, what you are talking about is before conception. That means before the sperm fertilized the egg, right? What you can do when you take products like Simply Nature PCOS or health product or products that improve your wellness is this: you are improving the quality of the environment where your eggs are produced. You're improving the quality of your body, the state of your body, your blood sugar levels, everything, right? Getting you ready for pregnancy. Okay, so PCOS and supplements that help you in this area in managing inflammation, in boosting your body's health is incredibly helpful for getting pregnant. Okay, so I just don't want you to be confused with what was said just now prior. When you know you are pregnant, then the first trimester, try to just follow your OB/GYN's advice, because I don't know your body's condition. Now, if you are trying to get pregnant, then I would say products like PCOS, just the tablets. You don't even need to take the extract. Just the tablets are great to get you into the peak of your health. All right, so that the quality of your eggs, and even your husband should be taking it, so that the quality of his sperm and the quality of your eggs are better, so that the baby is actually a healthier baby. Now, of course, in the process, I would then ask you not to just take tablets, but to take soft gel capsules. The reason is because then let's see if, while you're getting yourself ready for pregnancy, why not at the same time do something about the PCOS, right? So that is a win-win. Yeah. Unless Doc has anything that I missed out, yeah, that might be of concern.
Yep. Nothing from me. I'm good.
Right,
good.
so it's great. I know all this because, of course, the reason is me and my wife wanted to have baby. We actually had 2 miscarriages, right? Yeah, so we understand this. So this whole topic, we really then went into look into preconception. There is actually now clinics that 3 months before you try making a baby, they actually make you go through a lot of health tests and change your diet and everything just to improve the quality of the sperm and the egg, so that the baby that comes out, especially nowadays, some of us are a bit older when we are trying to get pregnant. So older pregnancies have older pregnancy risk, right? And there's also the risk about the quality of the baby that comes out. It may not be a normal baby. So there is actually prenatal, preconception care now. There's actually such things, right? For couples who are older, who want to improve their body as much as possible before they even try making the baby. So improving the ingredients to make the baby, right, even before the conception. And then there will be care during the first trimester, second trimester, and then of course there's also post-delivery. Yeah. So now it's that whole process. So just sharing with you because we went through the experience. Yeah.
Okay, for the last question this evening, what is the size of myoma that requires surgery? Or when do doctors suggest surgery for myoma?
Surgery for myoma, number one, if it's causing symptoms, if it's causing blood loss, abdominal pain, issues with urination, bowel movement, then it has to be removed. Size per se, let me double check. For size, 5 centimeters or larger. Yeah, 5 centimeters or larger. But this 5 centimeter or larger can be broken if some of the symptoms that I've said are present.
Okay. That's at least one, doc. Or what if she has 3 fibroids? One is 1 centimeter, then 2 centimeter, then another 2 centimeter equal to 5 centimeter.
No.
Okay.
One size,
Individual
yeah, it should be on an individual
basis.
myoma. But if you have multiple myomas, that's quite manageable. You don't have any symptoms, then it can just be observed. Just monitor the myoma, the size, if it's growing in size, if symptoms appear, yeah, those are the ones. But myomas can be treated with medications as well to control the size so that it doesn't grow bigger. Yeah, so you have to ask your OB for that.
Sir Sean?
No,
Okay.
that's good. Last question, right?
Yes, it looks like we've covered all our questions.
Oh,
So
very good.
let's wrap up this
So,
evening with your final thoughts for our viewers.
Doc first.
Yeah. Again, I would like to thank all of you for asking your questions, watching every single week. I look forward to. Wait, do we have a next week? Next week is Holy Thursday. Come on, please.
No,
Let's take a break.
Yeah, let's take a
Yes.
break.
Because I'll be at Tagaytay anyway, so the signal will not be. I don't know if the signal would be reliable or not. But yeah. So anyway,
okay.
I'll see you every
Even
single
the
week,
week
every
after
Thursday.
that, it's another holiday. Day of Valor.
Wow,
I'm gonna go
So
to the clinic for Day of Valor. Araw ng Kagitigan. No holiday for me except Holy Week for now.
Okay.
Yeah, so that's it for me. That's it for me. And one other thing, the things that we've discussed this tonight, these are for educational purposes only. This does not constitute a medical advice or to tell you what to do next. Ultimately, for you to determine what to do next, you have to go see your doctor. It may be your attending physicians, the doctors that are presently taking care of you, or you can come to me and well, let's see what we can do. Okay, so but that's it for tonight. Good night, everyone.
Thank you, Doc. Once again, when we started to do this program, it's very simple, which is to give you more information so that you understand what your doctors are telling you. So many times people ask questions here, and we are able to give an answer that is so long because we don't have the same time pressure as your doctor in his clinic. Okay, so again, as Doc says, please do not take this as a consultation, because we can't even see your face, the color of your eyes. No, these are very important, whether your eyes are yellowish, blood spot, whether your face is shiny, what's the vibrancy. When you talk, how's the quality of your voice? Is it strong? Is it weak? How's your breathing? All this is very important to be able to give medical advice. All right. So please do yourself a favor. Keep listening. Thank you for joining us on our program. So that you have more knowledge, so that when your doctor says something, you say, I understand what he's saying. Doc, what about this? You have questions that come out naturally. You're more confident to ask questions also and help you make better decisions. So again, thank you very much. We've been doing this program now, oh my God, Jen, for what? This is our 5th year or 6th year? Wow, I mean, time flies. When I knew Doc Jansen, we were both doing this, he was so young. He's still very dashing. But we both, he and I think, have more gray hairs now. So we've really been doing this program for a long time. Thank you very much to all our viewers, and we'll see you. We'll take a break next week. All right, it's a week. All right, and then we'll see you after that again. All right, I'll hand the time to Jen.
Thank you so much to our experts, Dr. Jansen, Kalalan, and Mr. Shyan Lim, for sharing their knowledge and insights. If you have any follow-up questions, don't worry, we will answer each of them next webinar, next week, or via direct message. So we hope to see you again next week for another empowering session, same day, same time, every Thursday night at 7:30 p.m. Because your health is the priority. In this world filled with the noise and uncertainty of global conflict, it's easy to feel like your personal health has been sidelined. We want to remind you your illness is still there and will be of urgent concern. So while the world watches the headlines, your body is fighting its own battle, and that battle doesn't pause for the news. Don't let global fear distract you from your recovery. Simply Nature PPARS is here to provide the steady cellular support and strength you need right now. Action is the best antidote to anxiety. So message us today. Let's refocus on your health together. And before we say goodnight, we just want to inform you that if you've been dealing with stubborn eczema, psoriasis, acne, or even recurring skin irritation, and nothing seems to work long-term, it's time to level up your skin game. Stop patching the problem, fix the environment. So introducing AD Pro Probiotic Serum, designed to support your skin barrier, calm irritation, and help rebalance stressed out skin. Whether it's breakouts, flare-ups, or rough patches, this is built for real results. And here's the best part. It's buy one, get one promo is still ongoing. It's available now on Shopee and Last Mall official website and via direct order. And if you buy a PPARS powder jar or a PPARS liquid vial, you will automatically get a free AD Pro Serum, giving you both internal cellular support and external skin nourishment in one powerful promo. And as part of our commitment, we're extending our free shipping promo nationwide for PPARS liquid vial and powder jar only, exclusive via websites orders. That's simplynature.asia. But if you're in a tight budget, that's okay, because if you buy the triple blisters of PPARS soft gel capsules, you are getting a free Renew mask. So a client is calling. But we do all this because we know cancer doesn't rest on weekends. So Simply Nature office is now open on Saturdays to better serve our clients. You may now place online orders and schedule product pickups every Saturday from 10 a.m. to 5 p.m. That's the pickup location is here in the Office Capital House Building, 9th Avenue, Corner Lane S, Fort Bonifacio Global City, Taguig, Metro Manila. Okay. For this upcoming Saturday, get a quick health advice with genuine care and support from someone who understands how it feels to be in your journey. That would be Ms. Sheila Sampaio. And she herself will be putting the free 1 bottle PPARS Plus tablets on your parcel. Now, lastly, if cancer has touched your life, this is your next step. Remission is not the finish line. The real work is building an internal environment that supports long-term stability. Join us for a live in-person seminar featuring a powerhouse panel of cancer experts as we unpack the science of inflammation, metabolism, and sustained recovery. It's entitled Beyond Remission, Building a Body That Sustains Recovery. That's happening May 30th Saturday from 8 a.m. to 11 a.m. in SMX Aura BGC Taguig. Seats are limited, so secure now. Talk to your assigned CSO or HCS. And thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group. Because your curiosity and victory about your health condition is what fuels our mission. Here in Simply Nature, we're always with you from start to healing.